Hey everyone, welcome back to another episode of Your Fitness Consult. I'm Dr. Mayer. I am a physician board certified in internal medicine and obesity medicine. As you can see, I'm in my powerlifting gym again. It's about 2 a.m. Today was my SBD workout. That's squat, bench, deadlift. In this program, on this particular day, I do squat, bench, and deadlift all in one day. Those are the three lifts, the big lifts of powerlifting. And this is the fourth week of my program. So the RPE is 9. That's rate of perceived exertion. That's a 9 out of 10. So I'm giving it my all. And so I just had a bunch of PRs and I am super pumped. I hope that you all got a good workout in. You're feeling pumped too. I'm so excited to bring you this episode. This is going to be a masterclass on gut health. I know gut health, the gut microbiome, that is a wellness trend right now. That's out there in the fitness influencer world. There's so many products, supplements, things people are trying to sell you in order to improve your gut health. Most of that is crap. I hope that we can talk about exactly what gut health is, what the gut does, and what you need to do to keep your gut healthy. And that will not include buying all of these supplements and products. There are very simple things that you can do to keep your gut healthy. Let's first start out with what the gut is. What do we mean by the gut? The gut is your GI tract. GI is gastrointestinal. So it's the entire tract from when you put food into your mouth, going down into the esophagus, into the stomach, into the small intestine, large intestine, rectum, and then out of your body. That's the whole GI tract. So many important things happen in that system. We take in our food, our nutrients, our energy, all of that is in our food. And then as it works its way down through that system, the body is processing it. It's extracting nutrients from it. It's eliminating the waste from it. What helps to do that in the pathway from our mouth out are trillions of microorganisms. It's bacteria, it's yeast, it's viruses. They all live in our GI system, particularly in our colon, our small intestine, large intestine. These microorganisms are totally normal. Our body needs them. They're our friends. They live with us. I know it sounds kind of weird that you're living with all these bacteria and viruses and yeast and all of that. Totally fine. Totally help our body. Some people call it your gut garden that's going on down there. These microorganisms, they have a sense of balance. Everyone is born with a different thumbprint of what your microbiome is composed of. So yes, there are trillions of microorganisms in our gut, but we all have a different mixture of those organisms. And so even though we all have an individual mix of these microorganisms, the goal is always the same. The goal is always to keep that mix stable and keep it happy. Why is that so important? It's important because the gut microbiome, all those microorganisms, they influence so many other things in our body. They can influence our hormonal balance, they can influence our sleep, they can influence whether we are in an inflammatory state. They can also influence our mood. They break down food into the nutrients that our body needs, including our macros, our fat, carbs, and protein, but also other nutrients, vitamins, minerals, such as B12, magnesium, iron. So keeping your gut in a healthy, stable, balanced state will also lead to those things being in a healthy, stable, balanced state. When the gut balance is out of whack, they call that gut dysbiosis. D-Y-S-B-I-O-S-I-S. The gut dysbiosis means that, that balance that we normally have is out of balance. There are certain types of those organisms, say certain bacteria, that are overgrown compared to how they usually are, which if those are overgrowing, that usually leads to suppression of other bacteria. So now we have too much going on of what this bacteria does, and then not enough going on of what this bacteria does. So what happens when your gut health is out of balance? You can definitely have GI symptoms. You can have bloating, you can have increased gas, you can have increased abdominal distension. You can have increased heartburn. You can have diarrhea or constipation or alternate between the two. You can have skin changes, increased acne, increased eczema. You can have issues related to mood, brain fogginess, increased anxiety. You can have sleep disruption, increased fatigue. You can have worsening perimenopausal or menopausal symptoms. And you can have what seems like unexplained weight gain or difficulty losing weight. So you see, this is a very important thing that we need to work to keep in balance. Let's now talk about what causes gut dysbiosis or the gut to become out of balance. One of the big medical ones would be antibiotic use. Whenever you take antibiotics, it's to treat a bacterial infection that you have. So this alters all the bacteria in our body, not just the one particular area that you have the infection. So it also alters the bacteria that are in our gut. This can lead to suppression of certain bacteria. If certain bacteria are suppressed, that can lead to overgrowth of some other bacteria. And so you get kind of too much of what this bacteria does and not enough of what that bacteria does, and that can throw it out of balance. Most of the time, that's something that will resolve after a few days, maybe a few weeks after you take the antibiotics. I'm sure many of you out there have taken a course of antibiotics for an infection, and you've had some GI symptoms, some bloating, maybe some diarrhea while you were on it, and then that got better within a few days of being off the antibiotic. Other medications would be things like anti-inflammatories, or what we think of as Advil, ibuprofen, or Aleve, naproxen. Taking these in the short term, really you won't see maybe that many symptoms from a GI standpoint, but taking those for a long period of time over the long term can definitely lead to an imbalance in the bacteria that are in our gut. Proton pump inhibitors that people take, antacids, such as omeprazole, which is Prilosec. That's one of the ones you can get over the counter. That can lead to a similar thing because that suppresses acid that's in our stomach, which goes down into our colon, our intestines. The acid that's in the stomachs normally kills off some of the bacteria that's in our gut. But if we suppress the acid with something like Prilosec, then that bacteria can overgrow. And that can lead to many of the symptoms of gut dysbiosis. Another big one would be metformin. Metformin can also do a similar thing. And if you are on metformin, you might notice that you have diarrhea. Many patients do, and that's the reason why they have to be taken off of metformin. All of these medications don't affect people in the same way. And so I am not suggesting you get off these medications. I'm not suggesting you never take these medications. Just know that they can possibly affect your gut health. And if you think that you're experiencing any of these symptoms from any of these medications, please go talk to your medical provider. Let's talk about stress. Stress, as we've talked about in the past, will increase our cortisol levels. Our increased cortisol levels can affect the gut motility, meaning how fast food moves through the system. It can either speed it up or slow it down. Either way, it's going to affect then how the bacteria can act and can extract the nutrients that it needs to extract. And that can ultimately affect so many of the different processes we've talked about in the body. In addition, increased stress leading to increased cortisol leads to sleep disruption, which can lead to changes in our mood. It can lead to increased cravings, and it can make us reach for foods that might not be healthy for our gut. Increased cortisol from stress also can affect the diversity of the gut microbiome, as we already spoke about, leading to suppression of some bacteria and increased production of other bacteria. Let's just make one final point about sleep. More and more research is coming out that our bacteria actually follow circadian rhythm as well. And so your bacteria likes a good night's sleep just as much as you like a good night's sleep. And just like you don't function well without that good night's sleep, neither does your gut microbiome. Let's move on to exercise. There's some research to suggest that increased exercise that is consistent and to a specific intensity can actually affect the diversity of the gut microbiome. And so doing a workout here and there, not really going to affect it, but actually doing exercise consistently and to a certain intensity, not meaning at the highest intensity that you can do, but certainly not just walking, but something that's more intense than, say, doing your normal activities of daily living, or maybe just an easy walk around the block. Okay, let's talk about the big thing now that affects our gut health, is our diet. If we eat things that are very high in sugar, or if we eat things that are very high in fat, or that are low in fiber, then that can lead to a decreased diversity of our gut microbiome, and it can lead to that imbalance. Now, this is not to say that you can't ever have anything low in fiber, high in sugar, high in fat. This would be something that is a consistent pattern over a period of time. These foods in general are safe and not unhealthy, and your body definitely needs sugar, needs fats, and it's totally fine to eat things that are low in fiber. This would be, though, if this is what your diet consisted of all the time, every day, it would be definitely not good for your gut health. And why is this? So in general, certain bacteria are very sensitive to sugar, and so they like that sugar. So when they see that coming down, that will make them very happy. That will make them produce more, overpopulate. And again, that leads to suppression of some of the other bacteria. Same with foods that are high in fat. We're going to talk about fiber in general more in the next episode, part 2, but fiber stimulates the gut microbiome to maintain its healthy balance. That's why having foods high in fiber are so important. It's the best thing that we can take in to keep that in balance. So when you're consistently eating things low in fiber, you are not stimulating your microbiome. When we hear that ultra-processed foods are bad for us, certainly lots of chemicals, things like that, aren't good for us for many reasons. And I know it's very hard to define what ultra-processed is, because all the things that we eat really are processed. Even if we have chicken from a package at the food store, that was processed from an actual chicken into that package. So it's hard to really define, but if we use the colloquialism of highly processed food, then that would be things with a lot of additives in them. Those foods are usually low in fiber. Those foods can be high in sugar. And so some of the additives, they can disrupt the microbiome, but certainly the fact that these foods are low in fiber definitely help to create an imbalance in the gut microbiome. Artificial sweeteners can also do that as well. I'm going to have a whole episode one day about artificial sweeteners, but things like sucralose, aspartame, our gut does not like this stuff. I know that if you use them, you probably do notice you might be a little more sensitive to them, and you might have some diarrhea, bloating, increased passing gas when you have more of those in your diet. And that is because it causes this imbalance. All of this is to say that, again, things in moderation can be okay. I'm not trying to discourage you from completely cutting things out of your diet 100%. This is everything in moderation, and just pay attention to the things that are going to make your gut healthy and work in some of that other stuff. But just make sure you have enough of the things that are going to make your gut healthy. Let's talk about a few more things that happen when our gut is in balance. If you are at a point where you feel that you are at a plateau and that you're just not losing weight, or that you're actually gaining weight when you haven't changed the things that you're doing, and that you're consistent, this is one thing to take a look at. There are studies that show increasing evidence that when the gut is imbalanced, it can actually affect the nutrients that are extracted from the food. So actually, you can have more calories extracted from the same food. That can lead to increased storage than as fat. Because the gut dysbiosis causes increased inflammation, that can lead to increased insulin resistance, which can lead to increased weight gain. And then we have, back to our old friends, leptin and ghrelin. When your gut is imbalanced, you can definitely then have an imbalance of leptin and ghrelin. So you can have increased ghrelin, increased cravings, decreased leptin, and that decreased feeling and thought of, let me stop, I'm full now. And certainly that can then lead to you increasing the amount of food you're eating, or different foods that you're eating to fill that craving, which can lead to increased weight gain. The last thing we'll talk about with regard to gut dysbiosis is hormonal balance and perimenopause, menopause. It's kind of a two-way street with this one. Estrogen and progesterone can affect the gut microbiome and affect the numbers of bacteria that are there in our gut. But also then on the flip side, that imbalance in gut bacteria can also influence levels of estrogen and progesterone. There's a subset of gut bacteria in the microbiome called the estrobolome. The estrobolome is a subset of the microbiome of the bacteria that's in our gut that's actually involved in the process of the metabolism of estrogen. And when it's healthy, it can lead to increased estrogen in our bloodstream, which is so important when you're going through perimenopause as your estrogen levels are decreasing, is to keep that part of the gut healthy, which is keeping the gut in general healthy. We want to have as much estrogen available to us as we can have. Interestingly enough, estrogen actually promotes movement of food through the body. Estrogen also can enhance serotonin levels. And when we have better, more balanced serotonin levels, we have better moods, we have decreased cravings. Progesterone does the opposite with regards to moving food through the gut. It actually decreases the movement of food through the gut. And that might be why when, as a female, when you're about to get your period in that luteal phase, kind of that PMS phase, those few days to a week before, you can have some increased GI symptoms, bloating, gas. And that's because that's when progesterone is at its highest levels. And so it's slowing things down in our GI tract. So it's just so interesting to think about how all of this stuff is all related to each other. Like, our body is such an impressive, complicated machine system. It's one of the reasons why I love my job. I love being a doctor, because everything's related to everything else. And it's so important to look at the whole picture, look at how everything is affecting all of the systems of our body. And that's why it's just so important to have a balance. So before we move on to the next part, which I'll talk about prebiotics and probiotics, I just kind of wanted to sum up what we've talked about already. So we kind of went through what the gut is from our mouth all the way down to the rectum. We talked about what happens, what the microbiome is. It's there to extract nutrients, break down that food, extract our energy, but it also keeps our hormones in balance. It helps with our sleep. It helps with our moods. It helps with our skin. It affects everything in our body, and that we want to keep that in balance. And to keep that in balance, we have to have high fiber foods. We have to avoid consistently having foods that are high in fat, high in sugar. We can have all of that in moderation, and that is totally fine. Same thing as we've gone through in every episode. Let's get good sleep. Let's exercise. Let's try to work on things that will decrease our stress. All of that will help to keep our bacteria in our gut happy, and then they will then in return help keep us happy and balanced. So they're kind of like our little friends that we want to keep happy, and then they'll be good buddies back with us. And sometimes I think about this when I'm eating certain foods. I know you're going to laugh at me, and you should, because it's ridiculous. But when I'm eating, I had asparagus with dinner tonight. I was eating my asparagus, and I was like, I'm feeding my gut buddies in my little gut garden. This asparagus is for you guys, and I like asparagus, but if you don't particularly like a lot of vegetables, just think about that. I'm not doing this because I have to lose weight, and this is the way to do it. I'm doing this because this is what my body needs. This is what my GI tract needs, so that it can help me then be in a better mood, get better sleep, be healthy. And so I'm just giving it exactly what it wants. I'm giving it its medicine. And when you think about that, you could eat that asparagus, you eat that celery, you eat those carrots, you eat that lettuce, you eat the things not because they're just low in calories, because that's what your body needs to stay happy. And if you want to think about them as little bacteria with little smiles on their face and that they're eating that celery down there, go ahead, because that's pretty cute. Okay, let's talk about prebiotics and probiotics. So these are the big supplements out there that you see them on all store shelves. You see them online. People are even pushing their own prebiotics and probiotics, especially in the perimenopausal state, especially towards women. So what are they? Prebiotics are the things that stimulate the microbiome to stay healthy. What are the big things that stimulate the gut to stay healthy? Well, we talked about that. Fiber. Fiber is the big thing. So these prebiotics are usually starches, fibers, other things such as inulin. You don't even have to know about any of that. It's just things that we can find in food, such as vegetables, that will serve to stimulate the bacteria that we have to make them happy, to make them nice and strong. You don't have to take a supplement for this. You are going to be eating those vegetables anyway. And in the next episode, we'll talk about specific foods that you can eat that are higher in the fibers that our gut likes. But you can eat these things, and you should be eating these things because they should be part of the changes that you're making as you're trying to lose fat. And so you don't need to take any additional supplements. Like, nobody needs to take a prebiotic. I don't want anyone ever to waste your money on a prebiotic. Absolutely 0% of people need a prebiotic if you are able to eat and if you are able to choose the foods that you can put into your body. And so, again, just know that that's all you need to do. Do not waste your money on these prebiotics. Anyone who's telling you to buy prebiotics and buy their prebiotics is selling you a load of crap when they could just tell you the vegetables and the foods that you can eat that will do the same exact thing and that you should be eating anyway. And if you want to know more about what those foods are, stay tuned for the second episode. Okay, so what are probiotics? So probiotics are actual bacteria, microorganisms that are being introduced into the body. So when you buy probiotics at the store and you see it say Cucurell or Lactobacillus, those are actual bacteria that are in those capsules that are being introduced into your gut. Most people do not need these either. As I mentioned earlier on, we all have a different fingerprint of microorganisms in our gut. None of us match anybody else. So what's in that pill is not necessarily going to be something that our body needs because we're all different. And you don't need to introduce bacteria into the gut. We already have bacteria in our gut. We need to do the things to make those bacteria happen. There are certain people that probiotics will benefit. And that would be, say you are on antibiotics and that you are sensitive to antibiotics in your GI tract. If you take probiotics during that time that you are taking the antibiotics, then you may not have those symptoms because as the antibiotics are killing off some of the bacteria in your gut, you're giving yourself back some bacteria in your gut. And so that might lessen those symptoms. There are some limited data that people who have inflammatory bowel disease or irritable bowel syndrome might benefit from taking probiotics. It might, again, lessen the symptoms of bloating and gas and diarrhea. The things with probiotics, though, is that it doesn't plant bacteria in your gut. So when you take the pill, it'll stay in your system for a little bit and then they leave. It's not like they plant themselves and then they'll grow. So it's not a solution to anything. It's a temporary introduction of bacteria into your gut. And so again, just like with prebiotics, I don't think anyone needs to take them. Probiotics, there's a certain subset of people, like I mentioned, that might benefit from them. But nobody has to take them again. This is not a thing. We all already have bacteria in our system, and we can just do the things that we need to do to make them happy. So that's the end of part 1 of the masterclass in the gut microbiome. Next episode, we're definitely going to talk about different foods we can eat, different fibers, whether we should take fiber supplements, all of that good stuff. I hope you've enjoyed this episode. I hope you learned a lot. If you have any feedback on it, please let me know. You can find me on Instagram, Dr. Mayer at Your Fitness Consult. Everywhere else, it's Your Fitness Consult podcast. Please check out my website, yourfitnessconsult.com. You can submit a question. You can email me. You can do the same through Instagram. And I'll talk to you soon. Thank you for watching or listening to the podcast. This podcast is not meant to be medical advice. I'm a physician, but I'm not your physician. And this is not a binding physician-patient relationship. All of this is for informational purposes only. Please don't use this content to substitute for your own medical provider's advice. Please go talk to your medical providers about all the questions that you have, and please listen to their advice. If there's an urgent situation you find yourself in, please call 911, go to the nearest emergency department, and just know that medical knowledge always evolves. So while this may be current knowledge at the time, whenever you're listening or watching this, that knowledge may have evolved. Talk to you soon.